Welcome to the Health Data Ethics Podcast. I'm your host, Jenny Owens, coming back after a bit of a break. Had some vacation with my family. It was delightful. But one of the things that happened before I left on vacation was that the Center for Medicaid Services made an announcement that caused a lot of conversation in health tech circles. This was back in late July. At a White House event, they unveiled the CMS health technology ecosystem. A lot of lay press and some of the subsequent discussion talked about make health tech great again. I think the best way to sum up the health technology ecosystem pledge is this quote from Dr. Oz, which is this. He said in a press conference that happened around the same time as this announcement, said, "For too long, patients in this country have been burdened with a healthcare system that has not kept pace with the disruptive innovations that have transformed nearly every other sector of our economy." I really honestly could not agree more. It's really hard to think about when I'm a patient. I interact with the healthcare system in such a different way than I do if I am shopping for groceries or if I am taking care of any of the other business of everyday life. Am I purchasing clothes? Am I trying to educate my children? The healthcare system is kind of unique. And in the amount of tech debt that it carries and in the amount that I am not in control of my own data and my own experience. If I go to buy groceries, I've got a card, a rewards card that tracks my purchases week to week. But if I don't like it, I can pack up, I can take my grocery stuff to another shop in the same town. I'm not necessarily burdened by my history with one particular grocery store. If I want to do that with healthcare, in particular, if I want to do that with data about my health that was generated by a healthcare institution versus data about my health that was generated by me. Is this information that I'm keeping in an app? Is it information that is from a wearable device? This is not a smartwatch. Or from like a ring? Is it information from a heart rate monitor or, like a written log? Aggregating that information about my health is very difficult. And so in order to appropriately manage my health, I have a very difficult time bringing together all of the information, all of the ways in which I as a person think about my health, not just my relationship with my doctor, not just the prescription medications that I'm taking, but my exercise routine, any sort of information about my activity. What am I eating? How much am I sleeping? Bringing all that together is really difficult. And so the CMS health technology ecosystem is really aimed at two main goals, one of which is universal digital access to health data for patients, right? This is their data. They should be able to aggregate, direct, and use it. And then streamlined clinical data access for payers so that we can make this easier for insurance companies to reimburse healthcare providers for the services they provide. That's it. These are very familiar goals. You've heard me talk about the difficulties of health data access for a while. The really interesting thing is that CMS went about these attempts to modernize the healthcare experience in kind of a different way. So instead of regulation, which might require passing a law or it might require other ways to incentivize the kind of behavior that they want to see, they went with the voluntary pledge. So this is ambitious. So far, we've got about maybe 60 organizations that have signed on to do the pledge. This is groups like Amazon and EHR providers electronic health record providers such as Epic, payers like United Healthcare, as well as provider systems like Intermountain and my home base Cleveland Clinic. But 60 organizations is not going to cover all of the patients in the United States. And if you've been in this space for a while, you'll know that responses to news like this tend to fall into two categories. This is unprecedented. It changes everything. It's a whole new world out there. Or we saw this forever ago. That didn't work, and this won't work either. Okay, like most things, the actual truth lies somewhere in the middle, right? This pledge is novel. It is also iterative. It is building on frameworks like health information exchanges and TEFCA, but it is also pushing on those with some tactics like having digital identity baked into access for patient and providers. They're using the phrase kill the clipboard, using QR codes and smart health cards that you can use to kind of verify your identity and allow access to your data. This is cool, and it's nice that CMS is not waiting for TEFCA to get its act together because TEFCA is kind of a slow burn. I want to spend a little bit of time talking about health information exchanges, HIEs, and TEFCA, and how this pledge is building on this, but it's not quite the same. So health information exchanges, or HIEs, were designed to help providers in a region share clinical data. I'll use my example of Northeast Ohio. We have 3 excellent health systems in the area. We have university hospitals, we have Metro Health, and we have my home base Cleveland Clinic. So if I, a patient, show up at any of these, hospitals that are not my usual provider, then the people who need to treat me can pull my information, my history, my labs, my meds, any sort of allergies that I might have from other local systems. The problem with health information exchanges is that they can be geographically siloed. So if I'm on vacation, several states away, they might not, the providing hospital there may not know necessarily to request my information from another organization. They're often underfunded, these health information exchanges. They are usually built on varying tech stacks, and they offer varying levels of integration and discreteness of the data that you're able to pull. The most important thing, though, is that these are provider-to-provider networks. They're not patient-facing. So if I happen to be on vacation several states away, I cannot just walk into the local hospital there and say, actually, can I please get a copy of my medical records? I want to take them to somebody down the street to get a second opinion. So health information exchanges are incredibly important. They've been phenomenally helpful, but they haven't really, from the patient perspective, transformed data access. So TEFCA. TEFCA stands for the Trusted Exchange Framework and Common Agreement. It's a federal initiative led by the Office of the National Coordinator and the Sequoia Project, and it's really meant to do two big things. One is that it's meant to standardize the national exchange rules. So if you are operating a health information exchange, you have to play by these very specific criteria, and also to create a backbone, kind of a meta network of QHINs, Qualified Health Information Networks, and those are intended to connect everything. So you can kind of think of TEFCA and HIEs. HIEs are your local highways, like your state highways, right? They're getting you from place to place locally with more speed than your surface streets with all the stoplights. TEFCA is the interstate highway system. It is really intended to bridge these gaps to move data and information from one place to the other very efficiently and in a standard way. So the goal is one patient, one record, anywhere you receive care. So the issue with TEFCA, because it is very ambitious, is that it's moving very slowly. We only have a few networks that have become qualified health information networks so far, and none of those are really live at the national scale. Also, TEFCA is missing patient-directed access. It is still very focused on provider-to-provider and payer-provider exchange. So the thing that is really encouraging to me is that CMS's new pledge puts patients back in the mix. It talks about the need for real-time access to data by patients. It talks about digital identity, which is something that patients want. The pledge isn't going to replace TEFCA, but it is saying that if you want patients to feel a difference, we're not going to be able to wait until TEFCA is fully operational. Okay, so why a pledge? Why not a rule? Why not legislation? And the answer to that is speed, right? This administration has been very clear that they value speed. We talked about this when we talked about America's AI Action Plan as well. That didn't involve rules or legislation. That involved an announcement and executive orders that went along with it. Regulation is a slog. The timelines are lengthy. So CMS wants action that can be measured by this by 2026. And we're also looking at some really nice political milestones coming up. We've got upcoming midterm elections, as well as a really meaningful national milestone, right? America's turning 250. So that's kind of cool. It'd be really nice to say, to pin a lot of things to this. Happy birthday, America. In this country now, you as a patient can get access to your health data and take it anywhere you want. A pledge gives CMS some flexibility and some speed, and it also gives them leverage should they choose to use it. We're going to come back to that. So the other thing that a pledge does is it introduces a little element of FOMO into the mix. When you see that somebody has signed on to this sexy new thing and they're getting a little bit of press about it, maybe you want to join as well. So that's cool. The voluntary nature of the pledge will definitely continue to grow the digital debt that a lot of healthcare networks are feeling. And when CMS reimbursements are falling, I'm really worried that people aren't going to have the budget to invest in voluntary tech initiatives, especially with no formal incentives. We'll come back to this in a minute. But let's talk about the people who have already signed on. So we have electronic health records. We've got Epic. We've got Oracle. We've got payers. We've got United. We've got Aetna. And of course, CMS itself. This is not an exhaustive list, by the way. You can take a look at everybody who's actually signed on the CMS website. We do have provider representation. So we have Intermountain, Cleveland Clinic, Providence. We've got networks, Datavant, some state HIEs, Care Quality, and then we have patient apps, patient-facing apps. So we have Cure AI, we've got Ellipsis, and then we've got like diabetes management tools. It's very cool. Participation is a little uneven. So we do have some big names, which is great, but there's a lot of regional systems and specialty EHRs that are missing. And here's the thing that really gives me pause. If this pledge is about putting data in patients' hands, does it work for all patients? Because Intermountain and Cleveland Clinic, we can build FHIR APIs in our sleep. We can do we can do this. We have already signed on. We're going to do this. It's great. It's very exciting. I'm not trying to downplay that at all. But what about the critical access hospital in Iowa that's got a 2-person IT team? Or, a federally qualified health center, maybe in the Mississippi Delta, that's still working off of a legacy EHR and unreliable internet? What if I'm a health system that's recently been acquired and we're outsourcing our IT? How do we do this? So digital equity means equitable access to your data and the digital tools to use it. But rural and safety net providers are often most constrained on budget and last in line for implementation grants and infrastructure upgrades. And without explicit funding or technical assistance, this pledge really risks deepening that divide. Really what that means is, the big names get the gold star, right? Good job. You did it. Congrats. You're still, very, very exciting and a total cutting edge digital healthcare provider. And the rest of the folks are still faxing. So I am in neither camp here. I'm not aboard like, oh, this is nothing, or an excited, this is everything. I'm just waiting to see how this starts to play out. And if CMS wants this pledge to work for all patients, not just those with flagship health systems or premium insurance, we need to fund the laggards and reward the leaders, so that you need to hit both ends of that spectrum. And then we also need to measure patient-centered outcomes, not just technical success. So what can you do if you're a health system? Take a look at the pledge. See if this looks like something that you might be willing to sign on for. And think about, what is it going to take to make this work for you and your health system? I would love to hear about it in the comments.